Professor Nikhil Patel. I'm the Deputy Chief of Medicine at East Sussex NHS Trust. Acute medicine at Eastbourne is a well-supported and well-staffed on-call shift. The teams that are present are a registrar, a senior member of the team, 2 core medical trainees and 2 foundation doctors. We run an on-call system which allows a hot on-call, which is the first on team. These are responsible for seeing acute patients on the medical assessment unit. And then we also have a so-called cold system where the foundation and core medical trainee cover the wards. However, at times when things are very busy, the second on team or the cold team come and support the team on the front end. We also have a group of doctors during the day that are on the medical assessment unit that support the on-call team with acute admissions.
The day on call over here in Eastbourne starts at 8:30 with a morning handover meeting. This is our morning handover room. This is where the day will start with the night team handing over to the day team, and also vice versa. This is where the day team will hand over to the night team at the end of the day. It's a new room. We've got all the facilities you need, so we've got a screen up here to review x-rays as well as computers just to have a look through the list. And you can also run the take from here if you really wanted to, so it's another room to get away from the ward and just focus on what you're doing. Once we've had a morning handover, the individual tasks for the different teams. So the first on and first SHO will be available to clock from 9 o'clock in the morning. The second on-call team, however, generally tend to look after the wards after 5 o'clock. However, we do have spikes in our admissions. Some seasons are busier than others, so we will call on the ward team to come down a little bit earlier, just in case it gets busy at the front end, but after 5 o'clock they'll be mainly looking after wards. This is our emergency department. For the size of hospital we do have a pretty busy A&E. For a first on-call team, you'll spend probably a majority of your time clerking in here before patients get transferred over to MAU. So this is our medical assessment unit. This is where most of our acute medical patients will turn up either from the community or once they've been clerked from A&E, they'll come here just to spend 1 or 2 days before they go to the ward or get discharged. What's quite important is all referrals should go into our referral book, as well as be put onto an electronic list which you'll know about from handover. Once we receive patients from A&E or directly from the community, they'll spend 1 or 2 days here until they either go to the ward or discharged from here directly. This is our coronary care unit. We usually get direct referrals here from the community via our paramedic service, particularly for our acute ST elevation MIs. We do encourage our on-call team to be present to receive them, help stabilise them before they go to lab, but also clock them after they've had their procedure. This will help gain experience and competency in managing our acutely sick STEMI patients.
During the on-call shift there can be some busy times and some quite challenging patients. And we have the senior registrar that's on the shop floor able to deal with acute emergencies for the junior doctors. We also have a medical assessment unit consultant, an acute medical consultant that is present on the shop floor to discuss more difficult cases and also to provide an area of supervision and teaching and learning. There is, during the early evening, a post-take round performed by one of the medical consultants who are more specialist and able to provide support and, again, teaching environment for the junior doctors.
Coming to the end of the day, we have another end of day meeting at 8:30, which is a chance for the day team to hand over to the night medical team. Again, we encourage our juniors or the entire team to basically go through every patient. We hand over obvious things that need to be handed over, such as reviews, jobs, etc. But also if there's an interesting case, we'll have a discussion or review of x-rays, interesting ECGs. And then that takes us through to 9 o'clock, where we'll have a hospital at night meeting. And the people or the attendees there will be the entire medical team consisting of a medical registrar, a medical SHO and a medical FY1 over at weekends, as well as an anaesthetic or IT registrar, outreach, surgical teams, etc. And again, that's another opportunity to discuss sick patients, as well as get advice from specialty. So if we do have a medical patient with a surgical problem, we can ask the surgeon there, and vice versa. This is our Mitcham unit. We've managed to get a rest room for nights up here, so simply just come up, introduce yourself to the nurse, and you can just head over to the restroom. It's got a couch in it, so you can have a nap if possible. It's also got a desk, telephone, so everything you need just to stay functional on take as well. As part of our hospital at night team, we have nurse practitioners as part of our site team. And what we're trying to encourage now, and so far has been very successful, is all the ward calls will go directly through the site manager or the night nurse practitioner and then be allocated on to the doctor. So that should reduce the amount of bleeps we get, bleep fatigue, and hopefully allow our doctors to concentrate on one task at a time. And with regards to emergencies, cardiac arrests, met calls, I'd suggest know your ALS algorithm so you have a rough idea of what's going on. But ultimately when you get there you will be allocated a job, whether that's taking bloods, timing, compressions, or even delivering shock therapy if you're confident enough. And just to help with that, we do have a cardiac arrest video which highlights the role of the F1 in that.
We run an on-call rota across the two sites. Essentially they run exactly the same. We have additional twilight rotas and we try and put additional doctors on over the weekend, especially over bank holidays and key holiday dates like Christmas. If you need to make a swap because you want to book some annual leave, your first point of call is to talk to your colleagues. Once you have your swap agreed, then you can submit your leave request to your administrator. Your administrator is Agnes Curtis, who is based at Eastbourne. All our annual leave and study leave requests are done online. We have health roster or medics online, and when you join the trust you'll be given a login that allows you to view your rota, view who else has requested leave, view how your ward is looking over a week, a month, the whole period, and your on-call commitments for that time as well. We also offer locum shifts if we have to cover any sickness. If unfortunately you're unable to come to work due to sickness, we ask you that you phone the administrator and you will be given her contact details when you start. It will be the administrator's role then to organise any cover that you may need. It will be her responsibility to notify the ward. You may have already let your colleagues know, but it has to be a phone call, not an email, not a text message. It does have to be a phone call to the administrator on the first day of your sickness, with a rough idea of how long you think you're going to be off and what the sickness is. It is also your responsibility to notify the administrator on your return.
For those that are new to the profession and are new to on-calls, don't worry. I mean, I know it can be a daunting time, but there are lots of people to support you. Don't be afraid to ask for help, and we don't expect you all to be specialists on day one of work. It's a learning process, and just take every opportunity to take advantage of those.
The on-call at Eastbourne is a good experience, a very supportive experience. We pride ourselves in ensuring that all our junior doctors are well supported during the day and at night time. So the whole experience should be quite enjoyable and a fantastic learning opportunity for you as a new junior doctor.